1 minute silent prayer. Thereafter, we can start the session. Thank you very much. As you know, every day we are conducting this webinar from 7:30 to 8:30 in Hindi, thereafter 8:30 to 9:30 in English, and 9:30 to 10:30 in Malayalam. And every day we are getting the new speakers, reputed speakers, and who come and give us the feedbacks on our understanding. So today we have important personality, Dr. A.K. Dwivedi. He is from Indore, and he's a professor at the Homeopathic Medical College, and he's a social worker and also the member of the CCRH, Scientific Advisory Committee. Very important personality, and every time you can see him doing some social activities for the prisons, and every day we can see his voice. So over to you, Dr. Dwivedi, for your today's topic.
Thank you, sir. Thank you, Dr. Sohani-ji.
Yeah.
And thank you for the team of IFHP. As the details of IFHP is for the promoting homeopathy, International Forum for the Promoting Homeopathy, and I am doing so for the promotion of homeopathy, what I can do. Let's start with the topic and we will discuss in between. I want to share my slides, and sharing is turn on. Please, sharing is not turn on. It's so
you can share, sir. It is possible, sir. You are the co-host. You can share, sir.
No, my iska kya naam hai? AIPS system. I am sharing from the system that is AIPS, Advanced Paramedical Institute. System is AIPS.
Let me see, sir. Let me see.
AIPS.
AIPS. Okay, just I am searching it, sir.
Ji.
Hi, sir. Make me host now. My problem is over, sir.
Okay, so let me. You find the
AIPS, Advanced Institute of Paramedical Sciences. ऐसा है क्या AIPS @
Yes, sir. I have seen it. I have seen, sir.
Yeah.
Please allow.
We make the co-host, sir. Okay,
Yes.
sir. And now, Dr. Dhanesh, I am making you the host now.
Yes, sir. Yes,
and
sir.
you can make me the co-host.
Definitely, sir.
Dr. Dhanesh, you are the host now.
Yes, sir. I have seen.
Is the slides are visible?
It is shared, but slide has not come up yet.
You have started sharing, but please open the. Please open the computer, sir.
Dr. Dwivedi, you have to open the your PPT now.
Yes, please open the PPT, sir. You just opened the laptop, but you didn't open the file. If you find any difficulty, you may do one thing, sir. You may close the file and then restart, reshare it, so that you can do it in a faster way. First, stop screen sharing, and then you may once again do it, sir. File first and then come out. Yes. Please open once again. Reshare it, sir. Okay. Now it is coming once again. Okay, now you can go to the part. Please find the file, sir. Index. It's not opening, sir. Just still stuck at Zoom. Ah, yes, it is coming. Now it's coming. Now you can make it big, sir. It's okay, sir. You can make you please unmute, sir. Please unmute yourself once again. You are muted. Yes, now it's okay. We can see you.
So my topic is anemia and homeopathy treatment.
Yes.
As Dr. Sahani told me about the promotional activity, I am showing few promotional activities done by me. For the sake of sickle cell anemia, Honorable President of India has given time to meet her and discuss what I am doing with the homeopathy for the sickle cell patients. So this is the luckily picture I have with the discussion on 10th January 2023. Then again she came to Indore. So I thanked her for the doing provision in the budget of 2023 for the anemia and sickle cell anemia patient. There are several press news as it is the promotional activities done by me for the sake of homeopathy. You can see this.
Good.
Trying to make aware people for the anemia. Many people think that anemia is not such a serious condition, and I am trying to get attraction that anemia is very severe condition and it is the cause of many severe diseases even. I am also making them aware how blood can be increased by the food and other things available at homes. You can go through these pictures. There are several types of anemia: aplastic anemia, sickle cell anemia, iron deficiency anemia, hemorrhagic anemia, vitamin deficiency anemia, thalassemia, MDS, ITP, pancytopenia, for which I am working since last 25-27 years. And so many patients are benefited by the help of homeopathy. If we talk about the anemia, that is the low hemoglobin, the causes might be fast food, eating pattern. Someone told vegetarian pattern, rice and wheat, but I don't think the patient which are coming to me is due to this. So what is the anemia? Anemia is the condition characterized by a deficiency of red blood cells, hemoglobin, leading to reduced oxygen transport to the tissue. It means the lack of oxygen at the tissue level. Various types of anemia. For what I am doing, firstly, I try to cover that aplastic anemia. As the name suggests, aplastic means less formation by the bone marrow. So aplastic anemia develops when the damage occurs to your bone marrow, slowing down production of new cells. Factors that can temporarily or permanently injure bone marrow and affect blood cell production includes radiation and chemotherapy treatment, exposure to toxic chemicals, use of certain drugs, autoimmune disorders, viral infection, unknown factors. If I will talk about the symptoms includes fatigue. Fatigue is the most commonest symptoms. Sometimes everyone feels fatigue, then feverish or fever, shortness of breath with exertions, rapid or irregular heart rate, then pale skin, frequent or prolonged infections, unexplained or easy bruising, nose bleeding, gum bleeding, profuse menstrual bleeding, prolonged bleeding from the cuts, skin rashes, dizziness, headache, etc. What we can do from the homeopathic medicines? Homeopathic medicines can boost the bone marrow, and the common medicines are what I am using: carcinosinum, natrum muriaticum, phosphoric acid, and sometimes arsenic album, sometimes Eupatorium perforatum, sometimes cinchona bark. What are the common medicines? We are having handful medicines for the anemia, sometimes calcarea fast, sometimes ferrum mate, ferrum fast. There are list of medications given in the therapeutic book, and I am using as per the investigation report of the patients and getting very good result on the aplastic anemia. So many patients have been treated completely 100%, and they are alive without any kind of medication, without any kind of allopathic medicine, and without any kind of homeopathic medicine. While previous doctors suggested them that you can't survive without the bone marrow transplant, and we have tried that homeopathy work like their bone marrow boosting. Another type is sickle cell anemia, very common anemia, sickle cell anemia. Sickle cell anemia is the hereditary, and we are facing a tough problem with the sickle cell anemia. In the nearby district of the Indore, that is Jhabua, Rajgarh, Dhar, there are several patients of sickle cell anemia who are coming regularly to my clinic, and I am requesting them that before going your marriage, please go for the investigation of HB electrophoresis so that we can see the status of sickle cell in the male and female. If both are having the sickle cell trait or sickle cell disease, so marriage in between them can't be possible. If the both male and female are having sickle cell and they get married, their children definitely have the sickle cell disease. Government of India tried to make people aware by their several processes, and they want that after 2047 there should not be any child born with the sickle cell disease. So I am thankful to Government of India, as Honorable President and Honorable Minister of Finance Nirmala Sitharaman has accepted my the application, and they put in to the budget of 2023. So I am giving thanks by the forum of IHP. Causes of sickle cell anemia: genetic mutation causing abnormal hemoglobin structure. As the name sickle cell means half moon, or sickle means hasia. Symptoms are severe pain, crisis, fatigue, and either splenomegaly or hepatomegaly. The best medicine is lachesis, calcarea fast, natrum sulph, and other medications are pulsatilla, natrum muriaticum. And for pain, sometimes I use China. Cinchona bark is the triose of pain as per NES. So I am getting very good result on the sickle cell patients to reduce their pain. And sometimes sickle cell patients represent with the low hemoglobin with avian. So with avian, if the patient is coming to me, the medicine is ferrum metallica. Another type is thalassemia. Thalassemia is another genetic disorder causing abnormal hemoglobin production. If we go in detail with the hemoglobin, you can see the major hemoglobin. We are having adult hemoglobin, which is denoted by the hemoglobin A, but written as HB. While the sickle cell patients are having HBS, that is the sickle hemoglobin, and thalassemia patients are having the HBF in the circulation, which is the mean for the fetal hemoglobin in the mothers while their fetus are in the abdomen. So their oxygen binding capacity is more, and if the child is having HbF in their circulation more than 10%, that might be thalassemia minor, and if the percentage of hemoglobin F, that is HbF, is increases, that turns into the thalassemia major. Symptoms: fatigue, jaundice, skeletal deformities in severe cases, and sometimes growth retardation. Homeopathic medications are ferrum metallicum, Cilicia, Calcarea fas, Natum muriaticum, and Pulsatilla. Another type of anemia is most commonest anemia in India is iron deficiency anemia. Causes is insufficient iron intake or absorption or chronic blood loss or increased damage during pregnancy. Iron is very easily available, but there is difficulty in the absorption of the iron. So iron deficiency anemia are more common. Symptoms are fatigue, pallor, brittle nails, shortness of breath. Homeopathic medicine is ferrum metallicum, ferrum phosphoricum, and cinchona bark. Next type is pernicious anemia, that is the vitamin B12 deficiency. This type of anemia is also very common. Inability to absorb the vitamin B12 due to the lack of the intrinsic factor or dietary deficiency. Symptoms are tingling in the extremities, memory issue, weakness, and fatigue. Medications, I generally suggest them to take some vitamin supplements. I never hide anything. So on this forum, I am also saying that I suggest these patients that please take some vitamin supplements, and homeopathic medicines are Calcarea fas, acid fas, and Nux vomica. Next is folate deficiency anemia. Causes are insufficient intake of folate, malabsorption, increased damage during pregnancy. Symptoms are fatigue, irritability, mouth sore. Medicines are Natum muriaticum and sulfuricum. Natum muriaticum is best medicine for the cracks and for fatigue, sometimes for apathy. So it works better on this also. Another type is hemolytic anemia. Premature destruction of red blood cells due to the autoimmune disorders, infection, or hereditary conditions. Nowadays, most of the doctors are saying that you are having an autoimmune disorder, which is another challenge to the society and doctor fraternity also. And I have seen very good results from the homeopathy on the autoimmune disorder, whether it is anemia or whether it is joint affection, SLE, arthritis, or skin diseases. Many patients are coming to me with the diagnosis of the other system that they are having autoimmune disorders. Symptoms of the patients are jaundice, dark urine, fatigue, enlarged spleen. Medicines are cinchona officinalis, phosphorus, arsenic album. Then another serious condition of aplastic anemia, another type is paroxysmal nocturnal hemoglobinuria, that is the PNH. Patients directly coming from AIMS, PGI, or CMC value, they are having diagnosis of PNH. This disorder causes red blood cell breakdown. PNH can lead to aplastic anemia. Yeah, aplastic anemia may evolve as PNH. Symptoms are dark red urine, fatigue, weakness, shortness of breath, irregular heartbeat, bruising or bleeding, blood clots. Medicines are arsenic album, phosphorus, cinchona, Nux vomica. Sometimes I use arnica and hemamylase. Another serious types of anemia is Fanconi anemia. This is also associated with the aplastic anemia. It is a rare inherited disease that leads to aplastic anemia. Children born with the taint smaller than the average and have birth defects such as undeveloped limbs. Another symptoms are bone marrow failure, physical abnormalities, increased risk of cancer. Homeopathic medicines are Arnica montana, Eupatorium perforatum, phosphorus, calcarea, carb, and sepia. Very common types is ITP, idiopathy, where the medical science is idiot, that is written as idiopathic thrombocytopenic purpura. That means we are not knowing exact reason how this is happening. That is the idiopathic thrombocytopenic purpura, means lower or lesser counts of platelets. Immune thrombocytopenic purpura or idiopathic thrombocytopenic purpura, type of thrombocytic purpura defined as the insolate low platelet count with a normal bone marrow in the absence of other causes of platelet. Here the difference is that in ITP, bone marrow is normal, while aplastic anemia, bone marrow is defected, and that's why the production is lower. But here the bone marrow is working normal, but the count is lesser. It causes a characteristic red or purple bruise spots like races. It looks like sometimes bruised skin, easily bruising and purpura, bleeding from gums or nose, blood in urine or stool, heavy menstrual flow, sometimes blood in stool or bleeding piles, and fatigue. Medicine is Arnica montana, Eupatorium perforatum, Phosphorus, Calcarea phos, Acid nitricum, and Hamamelis. Then another very serious condition is myelodysplastic syndrome, that is MDS, that is sometimes denoted with the bone marrow cancer, a group of disorders resulting from the poorly formed dysfunction blood cells. It's a rare condition, but nowadays very common, and in every month I am getting 2-3 patients of MDS from different part of India. Symptoms: fatigue and weakness, shortness of breath, unusual paleness, easily bruising and bleeding, frequent infection. Homeopathic medicines are Eupatorium perforatum, Phosphorus, Calcarea phos, Calcarea carb, sepia, etc. Another condition is pancytopenia. At the word denotes pancytopenia, which means less hemoglobin and RBC, WBC platelets, all are lessened. A medical condition in which there is a reduction in the number of red blood cells, white blood cells, as well as platelets, and less amount of the hemoglobin. Symptom: fatigue and weakness, shortness of breath, frequent infection, easy bruising, bleeding, pale or clammy skin, having heavy menstrual flow. Medicine is Arnica montana, Eupatorium perforatum, Phosphorus, Calcarea carb, and sepia. General lifestyle and dietetic advice for the anemia management. I always suggest to take rich iron food like spinach, legume, beets, fortified cereals, buggery, etc. Vitamin C. In vitamin C, I always suggest to take amla. Then some folate source such as nuts and seed, vitamin B12, eggs and dairy products, eggs and rich protein, that is fish. Then importance of individualized treatment, as we see in the homeopathy. Homeopathy works on the symptoms and individualized treatment. But I always use the pathological reports, and after medication, I ask to the patients to get CBC every week and talk to me. On the basis of CBC and their symptoms, I give them medicines. I am showing some patients which are cured by these all serious patients. A chronic disease cured patient with the homeopathic patient. Patient Sivan Singh, age is 20 month. He consulted, his father consulted me on 3rd May 2021. At the time of COVID, he has severe aplastic anemia with a history of gum bleeding, nose bleeding, and hemoglobin was 4.5 gram% and platelet was 4,000. After a few months of homeopathy, during treatment, his hemoglobin maintained and above the 9 gram% and platelets increases 50 to 60,000, and he don't need any kind of blood transfusion. While before consulting me, he needs regular blood transfusion at the interval of 2 to 3 days, sometimes every week. In few months of homeopathic medicines, his blood transfusion stopped and patients improving. At present, he is having more than 12 gram of hemoglobin and platelet is more than 2.3 lakhs, and he started his schooling, and at present he is not under any kind of homeopathic medication or any kind of other medication, and he is having no symptoms at all. He is regular in touch with me. He is from Bihar. His father is regular sending me CBC report every month or every 2 months. Another patient is Sikha Garg. She consulted me on 6/10/2019. Patient have only consulted on telephonic consultation. Her hemoglobin was 3.5 gram%, platelet was 10,000. With the history of profuse menstrual bleeding, black spot on the body. She has a history of chikungunya, for what she has taken lot of painkiller in 2016, and a history of dry cough in 2017. As per histopathological reports on 9/5/2019, she has a clear-cut diagnosis of hypoplastic aplastic marrow and with PNH. Patient used to go for blood platelet transfusion weekly. This continues till March 2022. She consulted me on 6/10/2019, and her transfusion was continued till March 2020. Then after, she did not require any kind of blood transfusion, and her menstruation cycle becomes normal. Her hemoglobin increases from 3 to 13 gram%, and her platelets increases from 10,000 to 2 lakhs, and she is now married and settled in the Canada. Her parents are very happy, and they want to do something for the aplastic anemia and PNH patients. That is another credit to the homeopathy. Another very serious patient, Iram Sheikh from Mumbai. She consulted me on 19/12/2070. She was having aplastic anemia. All these are the diagnosed case who comes with their investigation reports and doctor's prescription. She also has the history of ovarian cancer. She was having diagnosis of aplastic anemia. Her HB level was 6.7 and her platelet were 4,000. She also needs previously blood transfusion every week. At present, she is having more than 13.5 gram% of hemoglobin and platelets 1.7 lakhs. Now she is having normal life without any kind of medications. So homeopathy can fight against aplastic anemia and other type of severe anemia. My monthly magazine is Sehat Surat, available on website of Sehat and Surat. Thank you. If anyone has any questions, you are welcome. Hello. Hello.
Yes,
I-
sir. Yes, sir. Your presentation was really brilliant, sir. And you show the beauty of homeopathy in this forum by showing the power once again that we can do wonders with our medicine. And you are just concentrating more on this kind of chronic diseases so that those people get benefit out of it will definitely uh, uh, will give more publicity to that, and thereby more people will aware about all these things. And congratulations for your excellent um, presentation here in this forum, not only in this forum but for the general public also. That's why you got to the appreciation from the President of India itself, and we salute you for that, sir.
Thank you. Thank you.
Because you really deserve kudos, because not only you are doing a thing for homeopathy, but also it is definitely a big thing for homeopaths. We are all proud of you, not only for the you bring credit to you, but credit to all homeopaths in and around the world. And uh, sir, what is your success rate in this kind of patients?
In aplastic anemia, I am having 90% success rate. While
Okay,
in sickle cell anemia, no
okay,
patient has been cured till now, but their blood transfusion is reduced a lot, and their suffering, their severe pain is reduced, their hemoglobin level increased, their frequency of getting infection and frequency of getting fever is reduced, and they are likely to become near to normal to other children of their parents, but not any patients is still cured. And similarly in the thalassemia patients are also, but the problem with the thalassemia patients and sickle cell anemia patients are, if they go for the several times of blood transfusion, they get iron storage in the liver, iron storage in the spleen, and sometimes they get iron storage even in the skin. That is a very difficult condition for all the doctor fraternity. Patients come to me that they are having a large spleen, huge splenomegaly. Sometimes I just touch the spleen, come to the pelvis region. So huge splenomegaly I have seen several times, and we are helpless. Sometimes it doesn't reduce to normal, but
yes, sir.
yeah.
Yes, sir. You told us. You also told about the supplements, sir. But sir, there are homeopathic companies also making these supplements. What's your opinion on that? Whether you allow you just give the homeopathic supplements, or you just give allow the patient to take the
No, I never using supplements, because the patients who are coming from other hospitals, they are already
okay.
having several times of blood transfusion, so they get iron and ferritin level high in their blood reports. So I can't give them any kind of supplements who which can increase the iron. As iron increases or ferritin level increases, that reduces again hemoglobin. So I can't give any kind of supplements. I use always to give either 30 to 100 potency or 50 millisperm.
Okay.
I
Okay, sir.
always
Okay, sir.
always
Okay, sir. There are some other people also want to talk to you. I have questions also. So it
always
is the time for discussion. Dr. Beatrice Gassar, you can ask your question
most,
directly now.
most welcome, most welcome. Ji.
Yes. So, Dr. DWIVEDI, it was a very, very impressive presentation.
Thank you.
You very, but really impressing. It's like you are talking from a situation which normally is not possible. Also to treat that aplastic anemia. So I'm talking from Germany now, and I'm part of IFPH since a long time. I appreciate very much that work here. So could I perhaps ask you a question?
Yeah, yeah,
Yes.
yeah.
for me, it is impressing that the remedies you were talking about were quite common remedies like Natrium muriaticum, phosphorus, Calcarea phosphorica. And if we just talk about the first case, that little boy with the low thrombocytes, 5,000, and the bleeding problems, and you were able to cure that boy. Do you remember which was the remedy? Is the first question. The second question, how are you using the potencies in that severe conditions?
Very,
Please.
very good questions. See, if there is a bleeding, so it's our duty to stop bleeding first. So on their symptoms, on their severity, on their investigation reports, I love to give medication which works on their serious symptoms. If they are having bleeding, so it's our
Yes.
duty to stop bleeding first.
Yes.
The medicine is Homeopathy. If bleeding will not stop, how the hemoglobin will increase? So first point is to stop the bleeding. But difficulty is if the less amount of platelets, if the lower platelet count, bleeding will continue. So we have to work on this to stop the platelets, to increase the platelets and to stop the bleeding. So medication is to stop the bleeding, first give Homeopathy, then to increase the platelet counts and hemoglobin. There are in homeopathic materia medica and in therapeutics, if you will go for the read in therapeutics, you can find there are several medicine which can increase platelets. There are several medicine which can increase RBC. There are several medicines which can increase WBC. So I have differentiated what is the severity. If the platelet is lesser in number, I used to give the medicine which increases the platelet. If the RBC is lower, that means hemoglobin is lower, I used to give them medicine which can increase the RBC. If overall pancytopenia is there, I give them supplements, that is the ferrum metallicum in trituration, that is the 3x or 2x preparation. Ferrum phosphoricum in the trituration, that is 2x or 3x preparation, and Calcarea phosphoricum. The medicine which can work on the bone, that can boost bone marrow. That is the logic behind that. The medicine which works on the bone, that can increase the efficacy of the bone marrow, and by that the production of the cells can be increases. Getting my point?
Yes, very well explained.
sir.
Thank you very much. So, in case, let's say, with a little boy coming with a bleeding, you would start with Hamamelis, for instance. Yes, but how would be the potency and how often you would give the potency, please?
No, I am using 50 millismol potency 4 times a day. Hamamelis 0/1 4 times a day. Eupatorium perforatum 0/1 4 times a day. Using
What do you mean by what do you mean by 0/1?
Yeah, 0/1. That is the 50 millismol potency that is given in distilled water. That is
Very
dispensed.
good. I also like that potencies. 4 times a day. Very good. Thank you very much. Yes.
Okay, thank you, Dr. Beatrice, for such a beautiful question. And now it's up to Dr. Indrani Bhavatkar to speak. Yes, please unmute yourself. Dr. Indrani Bhavatkar.
Yeah, thanks, sir, for allowing me. So the presentation was really very nice, and this topic is very difficult, which we face in day-to-day life. So I will congratulate from everyone to you for doing excellent work. Okay, sir, I'm Dr. Bavadekar from Pune. I work in renal cases more over here. What is my observation until all renal patients, they are anemic, and they have a morphology of normocytic, normochromic anemia with normal bone marrow. And it's very difficult for me to approach such cases for anemia. So what will be your views on this? Kindly guide us.
Dr. Indranilji, you have put in such a serious questions behind in front of me, I am getting day-to-day practice when creatinine increases, hemoglobin decreases.
Very true. Very true.
Yeah. Even I have seen the creatinine level 22 and 24. Normal is 1.3 and patient approaches to me up to the 22, 24 creatinine having 3 times a day dialysis and not responded. So it's a very difficult condition to increase the hemoglobin level in such patients, but I have seen a good results up to the creatinine level 2.3, 4.3, 5.3, 6.3, even in up to the 9 creatinine I have given the results, but after 12, 13 no result. I have never seen any kind of results after 12, 13 creatinine level. But
Yeah.
when the creatinine level is lesser, it means 2, 3, 4, 5. In that cases, we can increase the blood and decrease the creatinine. But another problem is that the dialysis makes the man into machine. So you can't prevent them to go to the dialysis. One patient reached to my clinic. They are having dialysis 3 times a week. After giving homeopathic medicine, they improved a lot. Creatinine level decreases. Once a day, she develops some problems. She goes to that doctor nephrologist, and he denied to give her dialysis because she break the her break
Yeah. Routine break
once
हो गया.
once a week she stopped the going for dialysis. So doctor they called her a lot, and then she stopped to coming me for homeopathy. Another patient I have treated in Indore, one of the biggest hospitals suggested him for the uh, kidney transplant. That patient come to me. I have given homeopathic medicine for 1.5 years. His creatinine level comes to normal. He is a very young chap, 25 years, 26 years. His
Young
creatinine
fellow.
level decreases. He's absolutely normal. He again goes to consult that doctor just to show the creatinine level. My creatinine is normal. Then again that doctor is called him, and he stopped to coming me. Then he can come after 6-7 years. His creatinine level increases to 14, 16, and his hemoglobin level decreases to 4 to 6. Then I stop, doesn't give him medicine.
Okay.
I get very sad that
Yeah.
medical
Yeah.
faculty is not supporting us.
Oh,
Okay, sir. Yeah. Yeah. Yeah.
okay, sir. Thank you, Dr. Bhavakar. And now it's up to Dr. Hariharan Sahib.
Hello, doctor.
Ji,
Hello,
yeah.
doctor. Your lecture is amazing and very good information regarding this anemia.
Ji.
Doctor, I like to ask, see, what are these tests to be needed to find out which type of anemia? Laboratory tests. What are the laboratory tests?
Very common. I ask them to go for the CBC, complete blood count, every week. You have to see the RBC, WBC, platelets, and hemoglobin. If all are increases, that shows the results of homeopathic medications. And for the perfect diagnosis, the bone marrow aspiration or bone marrow biopsy is needed. But for the sickle cell anemia and thalassemia, you need to go for the HB electrophoresis. But the patients come with a prepared diagnosis from the biggest hospital of India. They approach us to AIMS, PGI, sometimes CMC Vellore, Medanta, Fortis. You have a ready-made diagnosis, and after giving homeopathic medicine, you can go CBC reports just to confirm whether your medicine is working or not.
Sir, another doubt is that what are the rubrics come under this anemic cases? Can you say?
I never tried any kind of rubrics. Just I am giving on the basis of therapeutic and diagnostic, on the basis of pathological reports only. I never tried to go for the repertorization. I never like to needed for the repertorization, getting a very good result. Where I am getting result, we will sluggish to work hard.
Yes,
Okay,
sir.
thank you, sir. Thank you, sir.
Yes, that means you are an artistic prescriber by all means, and you are prescribing the medicines with pathological
Yeah,
prescription.
pathology.
Yes, sir. That's a good way. Because of your confidence and because of your experience, you can do that. But is there any protocol for you for all these things, sir? You have mentioned about all these biochemical remedies and 1x or 2x or 3x like that, but as you rightly point out, that the bone marrow is the place where the blood is being produced, and as a result, you have to increase the strength of the bone in order to get more and more blood cells forming. So, is there any specific protocol? You told that Calcaria 4-6x, 3x is doing wonderful job for you in that.
Very fixed protocol I am having. First of all, I see all the previous investigation report, and prepared a chart date wise before consultation with me. What are the date, RBC, WBC, platelets, even I mention neutrophils and lymphocytes. And after start of homeopathic treatment, again I make a chart, the date wise, RBC, WBC, platelets, lymphocytes, and neutrophils. So after 6 months, 7 months, 10 months, I get increasing trends. Once I get increasing trend, patients wants that anyhow stop the blood transfusion. If patients goes for blood transfusion, their expenses is very high. In hospital, if they go for the single blood transfusion, they need to expend 16 to 20,000 for a single day or two. So their motto is anyhow to stop the blood transfusion. And my motto is anyhow to stop the bleeding. If their bleeding stop, their counts start to increase. So fixed protocol is pathological report before and after. Patient says that I am getting benefit, but I want investigation report from where they are getting investigated regularly. I suggest them go to that pathologic only, so that we can make sure that the method of investigation is same before and after.
Yes, sir. Sir, we used to say that when there is bleeding from veins, that venous type of bleeding, we can think of hemophilia, and when it is arterial blood, you can think of millefolium. What's your opinion on that, sir?
I never use mellifolium.
Okay.
I give different medicines for bleeding from different orifices. When it is bleeding from nose, that is epistaxis, the medicine is phosphorus. When there is bleeding from rectum, that is bleeding piles, the medicine is acid nitricum, not always hemophilia. So I used to give individualized treatment also sometimes on the basis of causes. If the bleeding from the vagina, that is the profuse menstrual bleeding, then I try to give pulsatilla and other medicine which can stop the menstrual bleeding also. Not always hemophilia will work. So
Okay, sir.
yeah.
Okay, sir. Then I invited Miss Rasa Bag to have a question to Dr. Dwivedi ji.
Hello, sir. Hello. Thank you for your good session. I have a question, sir. What's your protocol for von Willebrand anemia? Thank you, sir.
Protocol for anemia, that is the handful remedies. We are having a very good remedy that can increase the blood cells and then can boost the bone marrow. We are having a two kind of things. First of all, blood, then another bone marrow. So we try to give the medication which can increase the blood cells and which can boost the bone marrow. Once the bone marrow is stronger, that will produce a better cells. Bone marrow is doing production of the cells and also doing destruction of the cells. So we have to stop first destruction of the blood cells. If you will go to see in the dengue patients, what there is very fast destruction of the platelet. And if we give homeopathic medicine, what that did, homeopathic medicine stops destruction of the platelets immediately. And that's why the very next CBC report give the increase of platelet like 50,000, 80,000, 1 lakh even. What that did? That did the stop destruction of the platelets in bone marrow, and by which the cells are increases in their investigation report. So protocol is once increase the cells, boost the bone marrow, and to stop the destruction of the blood cells in bone marrow.
Good.
No, sir. I asked about the von Willebrand anemia.
Who will?
Von Willebrand. Von Willebrand.
Your voice is not clear.
Yes, not clear. What do you mean, sir? Please once again repeat the question. Or
Not
otherwise,
getting
hello.
Hello.
What you want to ask? Please mention it once again.
About von Willebrand. Von Willebrand.
Not getting your voice clear.
No, you may write it down in the chat box and then we can.
Okay.
On will branch.
Okay.
Okay. And now I invite Dr. Manoj.
Okay, thank you.
Dr. Manoj.
Von Willebrand.
Yes, now Dr. Beatrice, you can say auto thanks to the session also. You can ask your question, you can say something, and then you can say auto thanks to the session also, Dr. Beatrice.
Okay, thank you very much, Dr. Danesh. Dr. Dwivedi, one practical question, please, about remedies. Like in the dengue fever, you have that destruction of the of the erythrocytes. What would be your main remedies in that case, please?
Main remedies are arsenic album, phosphorus, Eupatorium perforatum, acid nitric, and hemamylase. Doctor, you are talking about the von Willebrand disease. Dr. Raza, you are getting my voice? Dr. Raza?
Yes.
If the platelets are low, then the blood will not clot.
Yes.
That is the bleeding disorders. Bleeding disorders is if you are having lesser amount of platelets in your blood circulation, the bleeding will continue. That is discussed in the previous slides.
Yes, sir. And now, Dr. Beatrice, it is the time to wind up the session. I invite Dr. Beatrice to say auto thanks to the session. Dr.
Okay,
Beatrice.
thank you very much. Thank you very much for that honor, and thank you very much for IFPH. And Dr. Dwivedi, it was a great pleasure to have you with us. And I don't know about your time, but perhaps it could be interesting to have one former presentations about that very special subjects and to go into the details of the patients. how do you treat, how often you repeat. That would be very, very helpful for us. And it's really impressing your work you are doing, and how you could help so severely sick people and to show the possibilities of homeopathy. I'm very impressed. And thank you very, very much for coming and presenting all your knowledge. And I'm thanking very much IFPH. And yes, I wish all best for you here from Germany.
Thank you. Thank you.
Thank you, Dr. Beatrice, and thank you, Dr. Ashwini Kumar Dwivedi, sir, and those who attend the session. With that, we come to the end of the day, 1,605th day. So over to our Malayalam session. Thank you all once again. See you tomorrow at the same time. It is up to Dr.